Hey, what's up, you guys? I got a really good DM today, and I wanted to answer the questions that they asked in the DM, but I also thought, a lot of people have this question. I had to deal with this to some degree. I know other people that have had to deal with this, so let's just go ahead and talk about this message. I'm not going to use the person's name. If they wanted to ask in public, they could have done it on the website or social media, so I'm going to skip that part. Hi, Nursing Uncensored. Need some advice. I'm currently an LPN from Ontario, Canada. New grad with only a year experience. I currently work PRN as a telehealth nurse, but my main source of income is being a PSW, a healthcare aide, in a government extra funding nursing home. I'm not sure what extra funding means, but send me another message. Tell me what it means, Canadian friends. I feel like I'm wasting my time working as a PSW, but I get a lot of hours and the pay is actually a bit better than what I get paid as an RPN. So to translate that for my American listeners, she's working as a CNA and the hours are better than her PRN LPN telemarketing. Not telemarketing. No disrespect to telemarketers or telehealth nurses, but they have very different jobs. So they go on to say, I feel like I'm wasting my time, but I get a lot of hours and the pay is actually a bit better. I see many classmates working as nurses and getting jobs in hospitals, and I feel like I'm wasting my time. I have no intention of staying in long-term care as I'm currently in the process of perusing a career as a scrub nurse. Do I just give up the PSW thing and risk not getting my hours, not getting my hours fluctuating, or do I keep doing what I'm doing and ride it out until I'm done with my scrub nurse course qualifications? Thanks, friends. Okay, so this is a lot, but first, before I go into a few points that I want to address, I want to just quickly recap my experience so you guys know where I'm coming from. This is not a one-size-fits-all solution. Everybody's different. You need to consider what's best for you and how you work best and how you deal with change and transition and all these things. But with that in mind, let me just say I was a home healthcare aide for like 2 years with stable patients with disabilities in the community. I worked as a CNA in a hospital for 11 years before I became an RN, but I never worked in a nursing home like proper. I did clinicals in nursing homes, just one actually, and so I can't talk. I have to be transparent and say, like, I don't work a nursing home, or I didn't work a nursing home, so keep that in mind as you listen to my advice, okay? So also, I did not get my LPN. So for those of you that don't know, the licensed practical nurse is like the 1-year nursing degree in the United States. I'm not sure what it is in Canada and elsewhere. But then with the second year of schooling, you can get your ADN, the associate's degree in nursing, and then get your license as a registered nurse. So I completed the LPN portion of the program and then went on to the RN portion. I never worked as an LPN. I didn't take the licensing exam for practical nursing. So the reason being was that I had a CNA job in a hospital on a unit where I wanted to work. So I didn't want to switch jobs just to be able to work as an LPN for like 8 months pending that I found a job right away. So just keep that in mind. Also, like, some people are like, well, I took the LPN exam because I wanted to like have a practice experience for the RN exam, the NCLEX. I was a non-traditional student that was paying out of pocket for a lot of things, so I didn't want to take like a $400 practice test for something I wasn't going to use. So so that's just how I did it. So keep all of that in mind as I talk about this. First, I want to address, they say, I feel like I'm wasting my time working as a healthcare aide, but I get better hours than working PRN and telehealth. So let's talk about that first. One is that depending on where you work and how intensive the cares are that you do, CNAs, patient care techs, I'm just going to say CNA because that's what I'm used to. So for the sake of healthcare worker, I'm talking CNA, certified nursing assistant, I'm just going to go with that. So CNAs play a vital role in all nursing environments. So whether that be nursing home, home health, hospital, intensive care, OR, like NAs are part of the beating heart of any healthcare system. We as nurses couldn't do what we do without nursing assistants. So I just want to say that I don't believe personally that any CNA job or NA job is a waste of time, because even though you may not be able to do things that are under your license, like you're not giving medications, you're not updating care plans, like there are definitely things that you're not doing as a patient care tech. However, one of the things I don't wear dark lipstick, and I'm like kind of paranoid that it's gonna get everywhere, so you can have a good laugh. Anyway, patient care techs do a lot of really hard work, and there's also a lot of time management, critical thinking, knowing when to get help, knowing when you're outside of your scope, that sort of thing. So I would argue that you're not wasting your time, because you're getting faster at these cares, you're getting better at these cares, you're paying attention. You may not be able to act upon someone's complaints or symptoms they're reporting, but you certainly can listen to your patients. You know, if somebody says, like, I'm having this problem, can you tell the nurse? You can tell the nurse, and then, depending on how the flow of your day goes, you can maybe learn from how that nurse responded. You learn to identify emergency situations. I believe that to work in a nursing home, you have to be CPR certified, so there is still the possibility. Like, I've done the Heimlich maneuver before on people, like when I had no licensing of any sort. So I think that if you are going to continue to work as a patient care tech, that you have to glean what you can and make it worth your while. Pay attention to the nurses. You don't have to have that responsibility to learn that responsibility. So pay attention to what they're doing. If you have a nice nurse that's not fucking so busy that she can't stop to breathe, let alone teach or talk, ask, hey, so-and-so said they had this problem earlier. What do we do for that? You can still learn, even if you feel like you want to be utilizing that license for practical nursing. Or what is it? The RPN. So I'm guessing registered practical nurse. That's what I assume. So here's the next thing that I want to address. The pay is actually a bit better, and you get a lot of hours. It is really hard to balance work and school when you're in nursing school. Oftentimes, some schools say they strongly encourage you not to work more than 20 hours a week. However, I know a lot of people that worked full-time when they were in nursing school. You just have to be that much more dedicated and have your shit together so that you're taking good care of yourself so that you can maintain that rigorous schedule. I say, I did not grow up in a family of wealth. I needed to work. I got really lucky, and I had a partner who was able to help me through my schooling, and I didn't have to work as much. So if you have that benefit, utilize it and remember to show your gratitude along the way. But if you don't have that and you have to work, stay where the money is. If you have benefits there, if you've earned raises, even though that's not your long-term goal, you can still try to learn things on the job. You can still focus on getting faster, better at talking to people, better at asking questions, better at all of these time management things. But also, you gotta pay your bills. If you're eating shitty food because you can't afford good food, how are you gonna do in clinicals in nursing school? Focus on taking care of yourself, and if that means that you have to kind of swallow your pride a little bit as you see your friends go off to jobs that you wish you could be in, and I'll get to that in a second, you have to focus on doing the best with your circumstances, because what somebody else is doing is not what's right for you. So I'll kind of leave it at that. And then as far as they say, I see many classmates working as nurses and getting jobs in hospitals, and I feel like I'm wasting my time. She says this twice. I feel like I'm wasting my time. I get it. You want to get that degree. You want to be in a hurry. You feel like you need to be doing things to prepare. And I'll kind of address this twofold. One is that in the world of nursing, So we all, we come up prereqs, we get those prereqs done, we all kind of meet, we start nursing school, we go through our program, we pray to God that we pass. Some people don't pass, they fall behind. Some people keep going, they move forward. Some people graduate. Some people drop out of the program, take a semester off, go back to a different program that maybe takes longer to do. It's really hard. It's hard not to compare yourself to the people that you're in classes with, at your cohorts. It's hard not to do that. But you have to remember that you are about to hit a lightning bolt in all directions of people doing things, getting degrees, not getting degrees, but getting certifications, not having experience, but having a lot of degrees, not having much degree advancement, but you have a shit ton of experience. There are so many different permutations. Like, I have a friend who has never worked as a nurse before. I've been a nurse 3 years now. I have my bachelor's degree. When she graduates from her program, she'll have a master's degree in nursing. She's never had a nursing job. That's okay, because we all can take different ways to get where we're going. You can be a scrub nurse, which, by the way, once you go through nursing school, you might find something else that you love so much more that you didn't even exist. So stay true to your dreams, fight for what you want, but also don't get so hyper-focused on that one job that you miss out on potential opportunities that might be fucking perfect for you. So that's what I'll say to that. But also, in terms of like the comparing yourself to others, there are always going to be people doing better and worse than you. You might have graduated sooner, but like me, I had crippling anxiety. So there were nurses that were newer than me that were doing better at their time management and their patient care because they didn't have the emotional setback that I had. So it's going to be real hard to compare. So you've got to work really hard to perish that thought. They might be working those nursing jobs, but also as they're working like an LPN job in a hospital, I assume that's what you mean, an LPN job in a hospital. But as they're going through their RN program to get their 2-year degree or their 4-year degree, they're also working in a new role that's potentially harder, maybe not. They are learning a lot, that's true. But it's not always green, it's always greener on the other side, isn't that what they say? So try really hard to remember that your path is yours. Mine was unlike any path any nurse I know has taken. But you know what? At the end of the day, we clock in and out at the same badge reader, and we take care of the same patient population. So I would say, while it's hard and you want to wear that badge that says nurse, and you want to get that, well, in this case, the nursing paycheck doesn't sound better than the steady hours at the CNA job, but I wanted that. I wanted to tell people, I'm a nurse. I do this. Like, this is what I am now. But just, you'll get there, and when you get there, you can say, I can assess 10 people's skin in an hour. And even if you're not going to stay in a nursing home, being able to prioritize, move quickly and efficiently, safely, that shit's going to pay off regardless of what job you end up in. CNA, LPN, RN, whatever job it is. And then what I'll also say is this. You have to know also, especially when you're working under or below your license. So, for example, you have an LPN or an what is it? I'm so sorry. I'm so bad with these because my brain is so fixed. So you're an RPN. You're a registered practical nurse. You're working as a CNA. So you can't do your LPN job because in that moment you are functioning as a CNA. So that's what you do. But if you have your LPN, at least in my state, check your nurse practice acts and laws in your own part of the world, wherever you are. But if I am working as a CNA, but I have an LPN, even though I can't do the tasks, I still have to report stuff that I would reasonably know as an LPN. So like a CNA might not notice a really subtle change in condition because they haven't been through like patho and nursing classes, but an LPN knows that. So if you're working as a CNA and you notice a subtle change in condition that you recognize because you have LPN training, you are still responsible for reporting that and making sure that it's addressed. So be careful with that. So just know what your practice acts are, what you can do and what you cannot do, and don't muddy it up in the middle. You don't want to say like, oh, well, technically she's an LPN, so like I'm just gonna, that nurse said I can just go give these meds. Be careful, because you're not functioning as an LPN then, and if anything ever happened, or there was an emergency, or something went wrong, you want to make sure that you don't have some liability where they're like, well, she wasn't supposed to be doing that day. So just be really careful with that, okay? So, I think that, let's see, is there anything else that I wanted to copy, oh yeah, so I have no intention of staying in long-term care. That's cool, I get it. I think long-term care is really hard. Some people love it. I'm glad they love it, because I don't think I could do it. It's a separate topic altogether, but I think long-term care is underfunded, understaffed, overworked. It's not great for the people that live there. It's not great for the people that work there, unless you are in a situation, which I don't think is the overwhelming majority, where you actually have good staff and a good, clean, safe, engaged living space. So that all depends. I get it. I get that you want to get out of the nursing home. And then perusing a career as a scrub nurse. Scrub nursing, I don't know a ton about it. I learned about it in nursing school. I know some friends that have done it. I, during nursing school, got to stand in on like 3 procedures, like a couple of them were in the cath lab. I got to observe the scrub nurse and the circulator, and like I got to see all those positions. But here's the thing, you have to remember the subtle details that make your job. It may be your dream job, that's cool. Maybe I'm just being a negative Nancy, but like when I think of a scrub nurse, I think you're wrapped in an ISO gown, gloves, hairnet, mask, pants, shoe covers. I am sweaty. I am going to be so miserable 5 minutes into that fucking procedure that even though I think it would be the coolest job and I would love to do it, I just don't think that doing it day after day after day is something that I would enjoy. So that sounds superficial and stupid, but that's a value judgment for me. That's a deal breaker for me. So I encourage you, if through your program or your school or whatever hospitals you partner with as you're going through your education, if you have an opportunity to actually follow, like shadow a scrub nurse, I highly encourage you to do that if you can. Because then you're really going to see, you're going to be on your feet with them all 8 hours. You have to be careful, you have to be sterile, you have to be really mindful of what the doctor is doing. I'm just saying, there are a lot of pros. It's super cool. It's a great job to have, the great hours, because you're not doing caths usually at like 4 in the morning, most of the time. But just kind of know what you're getting into, because I don't want you to be so hyper-focused on what you think you want that you like dismiss opportunities to do something else. Someone said something once, and I repeat it all the time, so if you've heard me say it before, I'm sorry, but the nursing job that you someday love may not even exist yet. So I encourage you to keep an open mind. I went in knowing like, hell no, I don't want to do labor and delivery. I don't want to do pediatrics. But when I went into that peds clinical, I still tried to be engaged, see as much as I can, talk to as many people as I can, really get a feel for what is it like to work here. And it just confirmed what I already knew, which is not a bad thing, because, I had to do the rotation anyway. So I didn't just go, I'm not sorry, I didn't mean to spit in your ear. I'm not just gonna go like, oh, I'm not gonna do that. I don't want that. And not even pay attention to it. Like, you at least gotta give it a shot, because what we see on ER and Grey's Anatomy and Chicago Med, some of that is real and some of that is the shit you see on TV. So really know that you want it before you cut off other avenues. That's what I'll say to that. Do I give up the CNA thing and risk not getting my hours? If I'm gonna distill it down, I say no. I say maximize your proactive behaviors at work, learn as much as you can, bank that money save as much as you can in nursing school, because you might find that there comes a time where you're doing care plans and you're not sleeping and you're not doing the shit you need to do for yourself, and you wished you would have maybe socked away a little something. Do as much as you can of that. I didn't do that. I struggled. So yeah, I hope that gives some of you some insights, or at least some things to think about. Because even if you're listening to me talk and you go, oh, hell no, that's not important to me, I don't care, like, the opposite is true for me. Cool. At least we've identified where you are and what you think. So, yeah. That is really all I have to say. I love getting emails. I don't always email back right away because I have too much going on in the digital space, so I'm trying to figure that out. But I love getting messages. I will try to answer all of them. If you haven't gotten a message from me, it means that I probably have a 3-page long message on my notepad about your question, and I just haven't distilled it down into something that people actually want to freaking listen to. So it'll come. I also have a long list of requests going all the way back to when the show was new. People were like, hey, this is a great idea, I'd love to hear something about this kind of nursing. I have it on a notepad. I haven't forgotten. Maybe I don't know. Like, I don't know any adventure nurses. I do, but they're hard to nail down. I've been trying to find an adventure nurse. If you're an adventure nurse, and what I mean by that is not just like a traveling nurse, like traveling nurses by nature are pretty adventurous, but like I want to hear about people that are like travel nursing in all parts of the world and are going there so that on their days off they can climb mountains and jump out of planes and do shit in countries that they weren't born in. So, or states, not even countries, states, provinces, whatever. So I'm working on it. That was like one of the first emails I got, and I was like, oh, I'm getting requests. And then I was like, oh, well, but yeah, I know one person who kind of did that went overseas and was only going to stay for like one contract and then stayed for like, I don't know, a year or two. And every time I looked at their Instagram, I was like, what? This is like cool shit. So I would love to talk to someone who is an adventure nurse. Message me either on Facebook or Instagram. You can find Nursing Uncensored by our name. And then nursinguncensoredpodcast@gmail.com. Send me a message. If you like the video format, let me know, because I've been dabbling with it, and I recently did an interview that I can't talk about yet. Somebody interviewed me. It's not going to be out. I don't know if it'll be out before or after this video, but there's stuff coming. I'm learning, I'm developing. Tell me what you want. What you really, really want. Oh my God. That's it, guys. Peace out. Happy nursing.